These are the chest disorders which has got a great connection to the hearing impairment. And the first one foremost, if the child is prematurely delivered or there is emergency cesarean sections or a forceps used for the child delivery, what happens during that time is the child is deprived of oxygen, and depending on number of seconds the child is deprived of the oxygen, there is going to be a damage. Sometimes in the brain damage, sometimes the brain damage doesn't happen, but the hearing organs are so sensitive that they can be damaged. And this premature child, or they develop a jaundice after that and they are put in the incubator. These are the children who can develop into a loss of hearing as isolated symptoms, not the other areas, and which is missed by many of the places. Number three is when there is a severe asthma or a child having a bronchopneumonia, where there is a reduction in the oxygenation happening in the lung. Again, same way there is hypoxia happens, oxygen level reduces and the heart is pumping lesser oxygen to all part of the body. So it goes to the brain or to the hearing organ, that causes a permanent damage in the hearing. And that is the reason all these patients require a proper care in a proper ICU or PICU, we call it as, or an ICU, where they can be taken care of and their pulse and oxygen levels are constantly monitored. If that is done, they can be prevented. And all these children who have either premature or urgent these things, they should always undergo what is called as OAE studies and the BERA studies to find out if there is any residual hearing when they leave the hospital. Because if it is there are many things which we can do it, like one can do a cochlear implant or put on hearing aid at the earliest, so that child can develop, as what we've rightly been saying, into a normal speech and other areas. This is how it causes the damage. There are commonly used autotoxic drugs, as I told you, that like garamycin, which is very commonly used for any infection either in the chest or for the loose motions, is very, very commonly used, particularly in the rural areas. These are very, very autotoxic and give rise to the damage. If the child has a malaria or a typhoid, the drug itself or the disease itself can give rise to the damage to the child's hearing, which should be avoided. And so whenever the child is on any medications, doctors should be very, very careful that it should not damage his hearing further.